Hello, I'm Dr. Jason Hoisington, your Faribault, Minnesota chiropractor. Today's topic is carpal tunnel syndrome and how do you know if you have it. It is a very common complaint that people have, and I see it pretty often in my office too. So chances are you know somebody who has had carpal tunnel syndrome or who has it currently, because it is very common. So if we look at the wrist, the anatomy of the wrist, the carpal tunnel is made up of bones and a ligament that goes across the top. Here's the wrist, here's the ligament in the wrist, and here shows, this cross section shows some of the bones, the carpal bones that make up the bottom part of that tunnel, the U shape, and then the ligament across the top. And inside here, in this tunnel, there's 9 tendons and a nerve, the median nerve, which is the nerve that's involved in carpal tunnel syndrome. And classic symptoms of problems with the carpal tunnel is tingling and numbness in these first 3 fingers. Sometimes the 4th finger can be involved. That's where the median nerve travels through that tunnel to those parts of the hand, those first 3 fingers. And the tingling, numbness, and weakness sometimes can result from carpal tunnel syndrome. People most at risk for carpal tunnel syndrome are women over the age of 50. Part of the reason for women being more likely to have carpal tunnel syndrome is the wrist is smaller and the tunnel is smaller, so there's less room for those tendons. If something were to go wrong there, some inflammation or some irritation, the nerve can get compressed easier. Or if you have a job that requires repetitive use of the wrist, quick motions or gripping, squeezing things can also lead to carpal tunnel problems. Additionally, a fall on your hand, if you fall down on an outstretched hand and injure your wrist, later on could have problems with the carpal tunnel as well. Conservative treatment is effective, especially if it's done quickly, early on. As with most things, early intervention is best. Chiropractic care is one option too that can help relieve carpal tunnel symptoms. We'll reserve a later video to talk about some of the techniques we use, but just know that it is an option, and the earlier you intervene, the better chance for good results. So hopefully you enjoyed this tip. I'm Dr. Jason Hoisington, your Faribault, Minnesota chiropractor.